CIA-funded experiments on black men are not an isolated Cold War injustice. They are part of a long and shameful history of medical racism in the United States. Black people have been subjected to unethical medical practices for centuries. The Tuskegee syphilis study, in which black men were denied treatment, is another horrifying example. This history of abuse has had a profound impact. Black communities harbor a deep mistrust of the medical system. This mistrust extends to psychedelic research. Despite the potential of psychedelics to treat mental health conditions, black participation in research and therapy remains low. Historical trauma plays a significant role. So too do cultural barriers and a lack of access to information. This mistrust has real consequences. It prevents black communities from benefiting from potentially life-changing treatments. Addressing this mistrust is crucial. We must acknowledge the harms of the past. We must work to create a more inclusive and equitable future for innovative science. Thankfully, there is hope. A team of black researchers, in partnership with the University of Ottawa, is working to address the injustices of the Addiction Research Center. This project is centered on healing and justice. It will gather testimonies from survivors and their families, and document the lasting impact of the ARC experiments. The research team will also work with black communities to develop culturally sensitive research practices. This project is an important step towards reckoning with the past and building a better future. The project's emphasis on community engagement is essential. By centering the voices of those most affected, we can begin to rebuild trust. We can ensure that future mental health research is conducted ethically and benefits everyone. Justice demands accountability for the harms inflicted at the ARC. The fight for reparations for survivors and their families must continue. We must also work to dismantle systemic racism in healthcare and beyond. Only then can we create a future where everyone has access to the potential benefits of mental health research. Thanks for listening. Join the conversation. Here's how you can get involved.